Question 1. The evaluation methodology shows that a 4-year-old child is admitted with a suspected viral respiratory illness. The healthcare team is considering implementing airborne isolation precautions. Which of the following actions best reflects adherence to current American Board of Pediatrics relevant guidelines for isolation precautions in this pediatric population? Option A. Implement contact and droplet precautions, as these are generally sufficient for most common viral respiratory illnesses in children and allow unrestricted family visitation. Option B. Implement airborne isolation precautions and ensure the child is placed in a private room, but do not require a mask for healthcare personnel entering the room if they are not performing aerosol-generating procedures. Option C. Implement airborne isolation precautions. Ensure the child remains in a negative pressure room, and limit family visitation to essential personnel only, while also providing age-appropriate distractions and opportunities for communication with family via video. Option D. Implement airborne isolation precautions immediately and maintain them until the child is symptom-free for at least 72 hours, without further clinical reassessment of the need for isolation. Correct answer is C. Implement airborne isolation precautions. Ensure the child remains in a negative pressure room, and limit family visitation to essential personnel only, while also providing age-appropriate distractions and opportunities for communication with family via video. Explanation. This scenario presents a common challenge in pediatric infectious disease control, balancing the need for effective isolation precautions to prevent transmission with the potential for these measures to negatively impact a child's psychological well-being and development. The professional challenge lies in accurately assessing the risk of transmission versus the potential harm of prolonged isolation, especially in a young child who may not fully understand the reasons for the precautions. This requires a nuanced understanding of both infection control guidelines and child development principles. The correct approach represents best professional practice because it prioritizes patient safety through adherence to established guidelines for isolation precautions, while simultaneously considering the holistic needs of the child. This aligns with the American Academy of Pediatrics (OP) recommendations and CDC guidelines, which emphasize that isolation should be implemented based on the specific pathogen and mode of transmission, and that efforts should be made to minimize the psychological impact on the child. This includes ensuring appropriate play, social interaction, when safe, and clear communication tailored to the child's age and understanding. An incorrect approach that relies solely on a blanket application of the most stringent isolation precautions without reassessment or consideration for the child's developmental needs fails to meet the standard of care. This could lead to unnecessary psychological distress, developmental delays, and a negative patient experience, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach that prematurely discontinues isolation precautions without confirming the absence of infectiousness poses a significant risk of nosocomial transmission, endangering other vulnerable patients and healthcare personnel, which is a direct contravention of public health mandates and infection control protocols. A third incorrect approach that neglects to involve the child's family in the decision-making process and education about precautions undermines a collaborative approach to care and can lead to non-compliance and increased anxiety for both the child and the family. Professional decision-making in such situations requires a systematic approach. First, accurately identify the infectious agent and its transmission routes to determine the appropriate level of isolation. Second, continuously reassess the child's clinical status and the duration of infectiousness based on evidence-based guidelines. Third, actively consider the child's age, developmental stage, and psychological needs, and implement strategies to mitigate the negative impacts of isolation. Fourth, engage the family as partners in care, providing clear explanations and support. Finally, consult with infectious disease specialists or infection control practitioners when uncertainty exists. Question 2. Consider a scenario where a 7-year-old child is prescribed a new daily medication for a chronic condition. The pediatrician needs to ensure the child understands why they need to take this medication and how to take it correctly. The child's primary caregiver is present during the appointment. Which approach best aligns with Vygotsky's sociocultural theory for facilitating the child's understanding? Option A. Pediatrician explains the medication's purpose and administration directly to the child using simple analogies and visual aids. then asks the caregiver to reinforce the information at home. Option B. The pediatrician provides the caregiver with a simplified explanation of the medication's purpose and administration, equipping them with age-appropriate language, and encouraging them to work with the child to practice taking the medication, answering questions as they arise. Option C. The pediatrician gives the child a complex medical brochure to read independently and emphasizes the importance of taking the medication on time. Option D. The pediatrician provides the caregiver with a detailed pamphlet on the medication's pharmacology and instructs them to explain it to the child in their own words, encouraging the child to ask questions. The correct answer is D. The pediatrician provides the caregiver with a detailed pamphlet on the medication's pharmacology and instructs them to explain it to the child in their own words, encouraging the child to ask questions. Explanation. This scenario presents a common challenge in pediatric practice, tailoring educational interventions to a child's developmental stage and cultural context, as emphasized by Vygotsky's sociocultural theory. The professional challenge lies in recognizing that a one-size-fits-all approach to health education is ineffective and potentially detrimental. Best practice requires understanding the child's existing knowledge, their social interactions, and the tools, both cognitive and physical, available to them, all central tenets of Vygotsky's zone of proximal development, ZPD, and the role of social interaction in learning. The correct approach, which involves a caregiver acting as a more knowledgeable other, MKO, to guide the child through understanding their medication, represents best professional practice. This aligns with Vygotsky's emphasis on social learning, where more capable individuals scaffold the learning of less capable ones. The pediatrician's role is to empower the caregiver with the appropriate language and concepts to effectively scaffold the child's understanding, respecting the child's current cognitive abilities and the social context of their learning. This approach is ethically sound as it promotes patient autonomy by empowering the caregiver to educate the child, and beneficence by ensuring the child's understanding leads to better adherence and health outcomes. An incorrect approach that relies solely on the child's independent reading of complex pamphlets fails to acknowledge the ZPD. This is a regulatory and ethical failure because it neglects the child's developmental limitations and the need for guided learning, potentially leading to misunderstanding, non-adherence, and adverse health events. It violates the principle of providing age-appropriate and understandable information. Another incorrect approach, which involves the pediatrician directly lecturing the child using abstract medical terminology without considering the child's current understanding or the caregiver's role, also fails ethically and regulatorily. This ignores the social aspect of learning and the child's ZPD, making the information inaccessible and thus not truly communicated. It is a failure to provide effective patient education, a core responsibility. The professional decision-making process should involve assessing the child's developmental level, identifying the MKO, typically a caregiver, and collaboratively developing a strategy for knowledge transfer. This involves breaking down complex information into manageable steps, using concrete examples, and encouraging interaction and questioning, all within the framework of the child's ZPD and social environment. Question 3. The review process indicates a pediatrician is evaluating a 2-year-old child whose parents report that the child is not yet speaking in short sentences and seems less interactive than other children their age. The pediatrician has observed the child during the visit and noted some age-appropriate gross motor skills but limited verbalizations. Which of the following approaches best aligns with current American Board of Pediatrics guidelines for assessing potential developmental delays in this scenario? Option A. Focus exclusively on the child's gross motor skills, as these are the most objective and easily measurable developmental milestones, and defer any discussion of speech or social development until a later visit. Option B. Immediately refer the child to a developmental pediatrician and a speech-language pathologist for comprehensive evaluations, as parental reports of delayed speech are a definitive indicator of significant developmental issues. Option C. Administer a standardized developmental screening tool. Conduct a focused physical examination to rule out obvious medical causes for delay, and discuss parental concerns and observations with them, planning for follow-up and potential referral based on the screening results. Option D. Rely solely on the parent's description of the child's communication and social interaction skills, reassuring them that children develop at their own pace, and that the observed behaviors are likely within the normal range of variation. The correct answer is C. Administer a standardized developmental screening tool. Conduct a focused physical examination to rule out obvious medical causes for delay, and discuss parental concerns and observations with them, planning for follow-up and potential referral based on the screening results. Explanation. The review process indicates a scenario where a pediatrician is presented with a child exhibiting developmental delays that fall outside the typical range for their age. This situation is professionally challenging because it requires the pediatrician to not only accurately assess the child's development, but also to communicate effectively with the parents, who may be experiencing anxiety or denial. The challenge lies in balancing the need for timely intervention with the importance of providing support and clear, evidence-based information. Careful judgment is required to differentiate between normal variations in development and genuine delays that warrant further investigation and intervention, all while adhering to established pediatric guidelines. The correct approach represents best professional practice because it aligns with the American Academy of Pediatrics guidelines for developmental surveillance and screening. This approach emphasizes a systematic, ongoing process of observation and assessment, utilizing standardized screening tools when indicated. It prioritizes a comprehensive evaluation that considers the child's overall health, environmental factors, and parental concerns. This method ensures that potential developmental issues are identified early, leading to timely referrals for specialized services and interventions, which are crucial for optimizing a child's long-term outcomes. This aligns with the ethical obligation to provide the highest standard of care and to act in the best interest of the child. An incorrect approach that relies solely on parental anecdotal reports without objective assessment fails to meet professional standards. This approach neglects the pediatrician's responsibility to conduct objective evaluations and can lead to underdiagnosis or delayed diagnosis of developmental delays, potentially missing critical windows for intervention. It also risks misinterpreting parental concerns or over-relying on subjective information, which is not a substitute for evidence-based assessment. Another incorrect approach that involves immediate referral for extensive, costly, and potentially unnecessary specialist evaluations without a thorough initial screening and assessment is also professionally unacceptable. This approach can lead to parental distress, financial burden, and a delay in identifying the specific nature of the delay if the initial referral is too broad. It bypasses the established tiered approach to developmental assessment recommended by professional bodies. A further incorrect approach that dismisses parental concerns as over-anxiety without a proper developmental assessment is ethically problematic. This can erode the parent-physician relationship and lead to a failure to address a genuine developmental concern. It is imperative to validate parental observations and conduct a thorough evaluation to rule out or confirm developmental issues. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and validation. Acknowledge and validate parental concerns. 2. Developmental surveillance. Continuously observe and inquire about the child's development during routine well-child visits. 3. Developmental screening. Utilize age-appropriate standardized screening tools, e.g., ages and stages questionnaires, parents' evaluation of developmental status when concerns arise or as part of routine care. 4. Comprehensive assessment. If screening tools indicate potential delays, conduct a more in-depth clinical assessment, considering all domains of development: gross motor, fine motor, language, social-emotional, cognitive. 5. Consideration of contributing factors. Evaluate for any medical, environmental, or social factors that might be impacting development. 6. Referral and collaboration. Make timely referrals to appropriate specialists, e.g., developmental pediatrician, speech therapist, occupational therapist, audiologist, based on the assessment findings. 7. Parent education and support. Provide clear, evidence-based information to parents about their child's development, the assessment process, and available resources. 8. Follow-up. Ensure appropriate follow-up to monitor progress and adjust interventions as needed. Question 4. Which approach would be most appropriate for a 10-month-old infant presenting with a weight that has fallen below the 5th percentile on standardized growth charts with no other apparent signs of illness? Option A. Conduct a detailed dietary history, assess feeding practices, and perform a thorough physical examination to identify potential causes of inadequate nutrient intake or absorption. Option B. Immediately recommend increasing the caloric density of all feedings without further investigation into the infant's current intake or feeding behaviors. Option C. Prescribe a broad-spectrum vitamin and mineral supplement to address potential micronutrient deficiencies contributing to poor growth. Option D. Refer the infant for extensive gastrointestinal workup to rule out malabsorption disorders as the primary cause of the growth deceleration. The correct answer is A. Conduct a detailed dietary history, assess feeding practices, and perform a thorough physical examination to identify potential causes of inadequate nutrient intake or absorption. Explanation. This scenario presents a common challenge in pediatric nutrition, where a child's growth trajectory deviates from expected norms, necessitating a thorough evaluation of nutritional intake and potential underlying causes. The professional challenge lies in distinguishing between normal variations in growth, inadequate nutrient intake due to feeding difficulties or socioeconomic factors, and potential underlying medical conditions that impact nutrient absorption or utilization. A systematic and evidence-based approach is crucial to ensure accurate diagnosis and appropriate intervention, aligning with the American Board of Pediatrics' emphasis on comprehensive patient care and adherence to established nutritional guidelines. The correct approach represents best professional practice by prioritizing a detailed dietary history and physical examination to identify potential nutritional deficiencies or excesses. This aligns with the American Board of Pediatrics' commitment to evidence-based medicine and patient-centered care, which mandates a thorough assessment of a child's nutritional status before implementing interventions. It reflects an understanding of the multifactorial nature of growth and development, recognizing that nutritional requirements are dynamic and influenced by various physiological and environmental factors. This approach ensures that interventions are tailored to the individual child's needs and are based on a solid foundation of clinical data. An incorrect approach that focuses solely on increasing caloric intake without a comprehensive dietary assessment fails to address the root cause of the growth deviation. This could lead to inappropriate recommendations, potentially exacerbating underlying issues or masking a more serious medical condition. It represents a failure to adhere to best practices in pediatric nutrition assessment, which requires a detailed understanding of the child's diet, feeding patterns, and potential barriers to adequate nutrition. Another incorrect approach that relies on generalized feeding guidelines without considering the child's specific age, developmental stage, and any existing medical conditions overlooks the individualized nature of nutritional care. This can result in recommendations that are either insufficient or excessive, potentially impacting the child's health and well-being. A third incorrect approach that immediately assumes a medical etiology without a thorough nutritional assessment delays appropriate nutritional interventions and may lead to unnecessary diagnostic testing, which is not cost-effective or patient-centered. The professional decision-making process for similar situations should involve a systematic evaluation starting with a detailed history, including birth history, feeding history, developmental milestones, and family history. This should be followed by a thorough physical examination, including anthropometric measurements and assessment for signs of nutritional deficiencies. Based on this initial assessment, a targeted dietary history can be obtained, exploring the types and quantities of foods consumed, feeding practices, and any reported feeding difficulties. If nutritional deficiencies are suspected, further investigations, such as laboratory tests, may be warranted. The ultimate goal is to identify the underlying cause of the growth deviation and implement appropriate, individualized interventions, whether they are nutritional, developmental, or medical. Question 5. Governance review demonstrates a pediatrician has identified potential behavioral concerns in a 7-year-old patient during a routine well-child visit. The pediatrician believes a formal behavioral assessment is warranted to understand the child's challenges and develop an appropriate intervention plan. However, the parents express some hesitation, stating they are not sure if such an assessment is necessary and are concerned about what it might reveal or how it might label their child. The pediatrician is confident that the assessment will be beneficial for the child's development. What is the most ethically and professionally sound approach for the pediatrician to take in this situation? Option A. Conduct the behavioral assessment without further discussion, assuming that the pediatrician's professional judgment supersedes parental concerns in matters of child health. Option B. Gently explain to the parents the rationale for the assessment, detailing the specific behaviors observed, the potential benefits of understanding these behaviors, and the process involved, while emphasizing that their informed consent is required before proceeding. Option C. Proceed with the behavioral assessment as planned, explaining to the parents that it is in the child's best interest and that their consent is implied by their presence at the visit. Option D. Acknowledge the parent's hesitation and suggest postponing the assessment indefinitely, focusing instead on general supportive advice for the child's behavior. The correct answer is C. Proceed with the behavioral assessment as planned, explaining to the parents that it is in the child's best interest and that their consent is implied by their presence at the visit. Explanation. This scenario presents a professional challenge due to the inherent conflict between a pediatrician's duty to advocate for a child's well-being and the legal/ethical obligation to respect parental autonomy and confidentiality, especially when dealing with sensitive behavioral assessments. The pediatrician must navigate potential parental resistance or misunderstanding of the assessment's purpose and implications while ensuring the child receives appropriate care. The complexity arises from balancing the need for accurate diagnosis and intervention with maintaining a therapeutic relationship with the family. The correct approach represents best professional practice because it prioritizes the child's welfare through a systematic, evidence-based, and collaborative process. Engaging the parents in a transparent discussion about the assessment's purpose, methodology, and potential outcomes fosters trust and shared decision-making. Obtaining informed consent is a fundamental ethical and legal requirement, ensuring parents understand what is being evaluated and why. Following up with appropriate referrals and support demonstrates a commitment to the child's ongoing care and addresses any identified needs comprehensively. This aligns with the American Academy of Pediatrics ethical guidelines and principles of patient-centered care, emphasizing the pediatrician's role as an advocate for the child within the family context. An incorrect approach that involves proceeding with the assessment without full parental understanding or consent would be a significant ethical and regulatory failure. This violates the principle of informed consent, a cornerstone of medical ethics and patient rights, and could lead to legal repercussions and damage to the doctor-patient relationship. It undermines parental autonomy and can create distrust, potentially hindering future engagement and treatment adherence. Another incorrect approach, such as dismissing parental concerns or immediately labeling the child without a thorough assessment, is professionally unacceptable. This demonstrates a lack of empathy and a failure to consider the family's perspective, which is crucial in behavioral health. It bypasses the necessary diagnostic process, potentially leading to misdiagnosis or delayed appropriate intervention, thereby failing to act in the child's best interest. A third incorrect approach, focusing solely on the child in isolation without involving the parents in the assessment and planning process, is also problematic. While the child's needs are paramount, behavioral issues often have family dynamics at play. Excluding parents from the assessment and subsequent planning can lead to incomplete information, resistance to recommendations, and a lack of support for the child at home, ultimately hindering treatment effectiveness. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the ethical and professional obligations. Recognize the duty to the child, the obligation to obtain informed consent, and the importance of respecting parental rights and autonomy. 2. Gather information. Understand the presenting concerns from all perspectives, including the child's and parents. 3. Communicate transparently. Clearly explain the purpose, process, and potential implications of any behavioral assessment to the parents. 4. Obtain informed consent. Ensure parents understand and agree to the assessment before proceeding. 5. Collaborate. Involve parents in the interpretation of findings and the development of a treatment plan. 6. Advocate. Ensure the child receives appropriate services and support, addressing any barriers to care. 7. Document thoroughly. Maintain clear records of discussions, consent, assessments, and treatment plans. Question 6. The risk matrix shows a potential conflict between a parent's strong preference for a specific brand of infant formula and the pediatrician's knowledge of the established health benefits of breastfeeding. The parent expresses concerns about the perceived convenience and efficacy of their chosen formula, while the pediatrician is aware of the immunological and long-term health advantages associated with breastfeeding. How should the pediatrician proceed to ethically and professionally manage this situation? Option A. Express concern about the parent's understanding of infant nutrition and gently guide them towards breastfeeding by highlighting the potential risks associated with formula feeding. Option B. Engage in a detailed, non-judgmental discussion with the parent, exploring their reasons for formula preference, providing comprehensive information on the benefits of breastfeeding, and addressing any perceived barriers, while respecting their ultimate decision and offering support for safe formula feeding if chosen. Option C. Immediately recommend exclusive breastfeeding, emphasizing its superiority and downplaying the parent's concerns about formula to ensure the infant receives the optimal nutritional benefits. Option D. Accept the parent's decision to use formula without further discussion, assuming their choice is well-informed and that the pediatrician's role is limited to addressing immediate health concerns. The correct answer is B. Engage in a detailed, non-judgmental discussion with the parent, exploring their reasons for formula preference, providing comprehensive information on the benefits of breastfeeding, and addressing any perceived barriers, while respecting their ultimate decision and offering support for safe formula feeding if chosen. Explanation. Scenario analysis. This scenario presents a common yet ethically complex situation where a pediatrician must navigate parental autonomy, infant well-being, and establish public health recommendations regarding infant feeding. The challenge lies in balancing the parent's stated preference and perceived benefits of a specific formula with the pediatrician's responsibility to advocate for evidence-based practices that promote optimal infant health, particularly concerning the established benefits of breastfeeding. The pediatrician must also consider the potential for judgment or coercion, which can damage the therapeutic relationship. Correct approach analysis. The correct approach involves a comprehensive, non-judgmental discussion that prioritizes education and support. This aligns with the American Academy of Pediatrics guidelines, which strongly support breastfeeding as the optimal method of infant nutrition and recommend exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding with introduction of complementary foods. The pediatrician's role is to provide accurate, evidence-based information about the benefits of breastfeeding, e.g., immunological, nutritional, developmental, maternal health benefits, and to explore the reasons behind the parent's preference for formula. This approach respects parental autonomy while fulfilling the ethical obligation to promote the infant's health. It involves active listening, addressing concerns, and offering resources and support to facilitate breastfeeding if the parent is open to it, or to ensure safe and appropriate formula feeding if that remains the chosen path. This is consistent with the principles of beneficence and non-maleficence, ensuring the infant receives the best possible nutrition while avoiding harm. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the parent's concerns and insisting on breastfeeding without further exploration. This fails to acknowledge parental autonomy and can alienate the family, potentially leading them to seek advice elsewhere or to withhold important information. It also neglects the possibility that there may be valid, albeit perhaps misinformed, reasons for the parent's preference that require addressing. Ethically, this approach risks violating the principle of respect for persons by not engaging in shared decision-making. Another incorrect approach is to passively accept the parent's decision for formula feeding without providing any information or support for breastfeeding. This abdicates the pediatrician's responsibility to advocate for evidence-based practices that are known to benefit infant health. While respecting parental choice, this approach fails to uphold the principle of beneficence by not actively promoting the optimal nutritional strategy for the infant. It also misses an opportunity to address potential barriers to breastfeeding that the parent might not have articulated. A third incorrect approach involves making judgmental statements about the parent's choice or perceived shortcomings in their understanding of infant nutrition. This is unprofessional and counterproductive, damaging the trust essential for effective patient care. Such an approach violates the ethical principle of non-maleficence by causing emotional distress and potentially undermining the parent's confidence in their ability to care for their child. It also fails to provide the supportive environment necessary for informed decision-making. Professional reasoning. Professionals should approach such situations by first establishing a trusting relationship through active listening and empathy. They should then provide clear, evidence-based information about infant feeding options, tailoring the discussion to the family's specific circumstances and concerns. The goal is to empower parents to make informed decisions that best support their child's health and development, offering ongoing support regardless of the chosen feeding method. This involves a collaborative approach, respecting parental autonomy while fulfilling the professional duty to advocate for the infant's well-being. Question 7. The investigation demonstrates that a pediatrician is meeting with the parents of a 2-year-old child who expresses significant anxiety about developmental screening tools, fearing that the process will lead to unnecessary labeling and over-medicalization of their child. The pediatrician has observed some subtle developmental nuances during previous visits that warrant further exploration using a standardized screening tool. The parents are hesitant to proceed with the screening at this visit. What is the most appropriate course of action for the pediatrician in this situation? Option A. Respect the parents' immediate wishes and postpone any developmental screening indefinitely, focusing only on addressing acute health concerns during the visit. Option B. Gently explain the purpose of the screening tool as a way to identify children who might benefit from early support, acknowledge their concerns, and propose a plan for follow-up and further discussion if the screening indicates a need for more in-depth evaluation, while respecting their current hesitation to complete the tool today. Option C. Strongly advocate for the immediate completion of the screening tool, emphasizing the potential negative long-term consequences of delaying identification of developmental delays, and downplay the parents' concerns as common but unfounded anxieties. Option D. Proceed with the screening tool as scheduled, assuring the parents that it is a routine part of well-child care and that their concerns will be addressed after the results are obtained. The correct answer is B. Gently explain the purpose of the screening tool as a way to identify children who might benefit from early support, acknowledge their concerns, and propose a plan for follow-up and further discussion if the screening indicates a need for more in-depth evaluation, while respecting their current hesitation to complete the tool today. Explanation. This scenario presents a common ethical dilemma faced by pediatricians, balancing the need for timely developmental screening with parental concerns and potential resource limitations. The challenge lies in navigating parental apprehension about labeling or overdiagnosis, while upholding the pediatrician's ethical and professional responsibility to identify potential developmental delays early. Early identification is crucial for accessing timely interventions, which are proven to improve long-term outcomes for children. The American Board of Pediatrics emphasizes evidence-based practice and patient-centered care, which includes open communication and shared decision-making with families. The correct approach involves a multifaceted strategy that respects parental autonomy while prioritizing the child's well-being. This includes clearly explaining the purpose and limitations of the screening tool, addressing parental concerns with empathy and factual information, and offering a plan for follow-up and further evaluation if indicated. This approach aligns with the ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm by delaying necessary intervention, as well as the principle of respect for autonomy by involving the parent in the decision-making process. It also adheres to guidelines from professional organizations that advocate for routine developmental surveillance and screening. An incorrect approach would be to dismiss parental concerns outright, or to proceed with screening without adequate explanation or consent. This could be perceived as paternalistic and may erode trust in the physician-patient relationship, potentially leading to noncompliance with recommendations. Ethically, this fails to uphold the principle of informed consent and respect for autonomy. Another incorrect approach would be to forego screening entirely due to parental reluctance, even when the pediatrician has clinical concerns. This would violate the duty of beneficence by potentially delaying crucial early intervention, which is a core tenet of pediatric practice and aligns with established screening guidelines. Failing to document the discussion and the rationale for any decision regarding screening also represents a professional and ethical lapse, hindering continuity of care and accountability. The professional decision-making process in such situations should involve 1. Active listening and empathetic acknowledgement of parental concerns. 2. Clear, jargon-free explanation of the screening tool's purpose, benefits, and limitations, emphasizing it as a tool for identifying children who may benefit from further assessment, not a definitive diagnosis. 3. Open discussion about potential next steps, including referral for further evaluation if screening results are concerning. 4. Collaborative decision-making with the parent, documenting the discussion and the agreed-upon plan. 5. Adherence to established screening guidelines and best practices for pediatric developmental surveillance. Question 8. Market research demonstrates that many adolescents exhibit suboptimal dietary patterns, leading to concerns about nutrient adequacy. A pediatrician is evaluating a 15-year-old female who presents for a routine well-child visit. The adolescent reports frequent consumption of fast food and sugary beverages, with limited intake of fruits and vegetables. Her mother expresses significant worry about her daughter's nutritional status and potential long-term health consequences. Which of the following approaches best reflects current best practices for addressing nutritional needs in adolescents according to the American Board of Pediatrics guidelines? Option A. Recommend a daily multivitamin supplement to ensure adequate micronutrient intake, given the reported poor dietary habits. Option B. Advise the adolescent to immediately eliminate all fast food and sugary drinks from her diet and replace them with strictly controlled, pre-approved healthy meal options. Option C. Reassure the mother that most adolescents go through phases of poor eating and that her daughter will likely correct her diet as she matures, focusing the visit on other health concerns. Option D. Conduct a thorough dietary assessment, including a 24-hour recall and food frequency questionnaire. Discuss the importance of a balanced diet for growth and development, and collaboratively set small, achievable goals for increasing intake of nutrient-dense foods while addressing potential barriers. The correct answer is D. Conduct a thorough dietary assessment, including a 24-hour recall and food frequency questionnaire. Discuss the importance of a balanced diet for growth and development, and collaboratively set small, achievable goals for increasing intake of nutrient-dense foods while addressing potential barriers. Explanation: this scenario is professionally challenging because it requires the pediatrician to balance evolving nutritional guidelines with the practical realities of adolescent eating habits and parental concerns, all within the framework of established pediatric best practices. Adolescence is a period of rapid growth and development, making adequate nutrition critical, yet it's also a time when peer influence, body image concerns, and increased autonomy can lead to suboptimal dietary choices. The pediatrician must provide evidence-based advice that is both effective and culturally sensitive, avoiding overly restrictive or judgmental approaches that could alienate the adolescent or parent. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the adolescent's current dietary intake, activity level, and psychosocial factors. This aligns with the American Academy of Pediatrics (OP) recommendations for nutritional counseling, which emphasize a non-judgmental, collaborative approach. By focusing on education, goal setting, and addressing potential barriers, the pediatrician empowers the adolescent and parent to make sustainable positive changes. This approach respects the autonomy of the adolescent while ensuring the parent remains involved and informed, fostering a partnership in health. It also implicitly adheres to ethical principles of beneficence and non-maleficence by aiming to improve health outcomes without causing undue stress or harm. An incorrect approach that focuses solely on recommending a generic multivitamin without assessing current intake fails to acknowledge the individuality of nutritional needs and the potential for oversupplementation, which can be unnecessary and potentially harmful. This neglects the principle of personalized medicine and the AAP's emphasis on obtaining nutrients from whole foods whenever possible. Another incorrect approach that involves immediately prescribing a restrictive diet based on perceived unhealthy foods without understanding the adolescent's current habits or underlying reasons for those choices is overly prescriptive and can lead to disordered eating patterns or rebellion. This approach lacks the necessary psychosocial assessment and can be detrimental to the adolescent's relationship with food and their body image, violating the principle of non-maleficence. A third incorrect approach that dismisses parental concerns about the adolescent's eating habits without a thorough evaluation, assuming the adolescent is making appropriate choices, overlooks the crucial role of parental guidance and the potential for underlying nutritional deficiencies or excesses that may not be apparent. This fails to uphold the pediatrician's responsibility to address parental concerns and ensure the adolescent's well-being. The professional decision-making process for similar situations should involve a systematic approach. First, gather a detailed dietary history, including meal patterns, food preferences, and any perceived barriers. Second, assess the adolescent's growth parameters and activity level. Third, engage in open-ended, non-judgmental dialogue with both the adolescent and parent to understand their perspectives and concerns. Fourth, provide age-appropriate education on the importance of balanced nutrition for growth, energy, and overall health. Finally, collaboratively set realistic, achievable goals for dietary improvement, offering ongoing support and follow-up. This process ensures that interventions are tailored, evidence-based, and ethically sound. Question 9. Performance analysis shows a pediatrician is evaluating a 5-year-old child presenting with some unusual problem-solving approaches during a play-based assessment. The pediatrician is considering how to interpret these behaviors in light of established developmental theories. Which of the following approaches best reflects a comprehensive and developmentally informed evaluation of this child's cognitive functioning according to Piaget's theory? Option A. Assess the child's ability to engage in symbolic play, understand conservation tasks, and demonstrate logical reasoning about concrete objects, comparing these observations to the typical characteristics of the preoperational stage. Option B. Rely exclusively on the parent's description of the child's problem-solving skills at home to determine their cognitive stage. Option C. Interpret all observed behaviors as typical for a 5-year-old, assuming that any perceived difficulties are simply a phase that will resolve without specific intervention. Option D. Focus solely on whether the child exhibits egocentrism, as this is a hallmark of early cognitive development, and conclude that any deviation indicates a problem. The correct answer is A. Assess the child's ability to engage in symbolic play, understand conservation tasks, and demonstrate logical reasoning about concrete objects, comparing these observations to the typical characteristics of the preoperational stage. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric practice, where a clinician must interpret a child's behavior through the lens of developmental theory to inform diagnosis and management. The difficulty lies in distinguishing between age-appropriate exploration and behaviors that might indicate a developmental delay or a more significant cognitive issue, requiring a nuanced understanding of Piaget's stages. Misinterpretation can lead to unnecessary interventions or delayed appropriate support, impacting the child's long-term development and family well-being. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates direct observation of the child's play and problem-solving with information from caregivers, all interpreted within the framework of Piaget's theory. This aligns with best practices in pediatric assessment, which emphasize a holistic view of the child. Specifically, understanding that child in the preoperational stage, ages 2-7, is characterized by egocentrism, symbolic thought, and intuitive reasoning, and that a child in the concrete operational stage, ages 7-11, begins to think logically about concrete events, allows the clinician to accurately gauge the child's cognitive abilities. For instance, observing a child struggle with conservation tasks, like understanding that the amount of liquid remains the same even if poured into a different shaped container, will be expected in the preoperational stage, but might signal a delay if observed in a child clearly in the concrete operational stage. This approach is ethically sound as it prioritizes accurate diagnosis and appropriate care based on established developmental science, avoiding premature labeling or dismissal of concerns. Incorrect approaches analysis. One incorrect approach is to solely rely on parental reports without direct observation. While parental input is crucial, parents may not always accurately perceive or interpret developmental milestones, or they may be influenced by anxiety or comparisons with other children. This approach fails to adhere to best practices in pediatric assessment, which mandate objective evaluation. Ethically, it risks misdiagnosis by not gathering sufficient objective data. Another incorrect approach is to dismiss the observed behaviors as simply childish, without considering the child's developmental stage as described by Piaget. This overlooks the possibility of a genuine developmental lag or cognitive difference. It is a failure to apply established developmental frameworks, leading to potentially inadequate or inappropriate care. Ethically, this approach neglects the professional responsibility to thoroughly investigate developmental concerns. A third incorrect approach is to focus exclusively on a single Piagetian concept, such as egocentrism, and base the entire assessment on it. Piaget's theory is multifaceted, and a child's cognitive development is assessed through a range of abilities and behaviors. This narrow focus can lead to an incomplete and potentially inaccurate understanding of the child's cognitive functioning. It fails to represent a comprehensive best practice evaluation and carries ethical implications of incomplete assessment. Professional reasoning. Professionals should employ a systematic approach that begins with gathering a detailed history from caregivers, followed by direct observation and interaction with the child, utilizing age-appropriate tasks that probe various aspects of cognitive development as outlined by Piaget. This includes assessing symbolic play, logical reasoning, conservation abilities, and perspective taking. The clinician must then synthesize this information, comparing the child's performance against established developmental norms within Piaget's theoretical framework. If discrepancies arise, further targeted assessment or referral for specialized evaluation may be indicated. This iterative process ensures that clinical judgments are evidence-based, developmentally appropriate, and ethically sound, always prioritizing the child's best interests. Question 10. Risk assessment procedures indicate a 2-year-old child is exhibiting behaviors that caregivers describe as unusual and not like other children their age, including limited verbalizations and difficulty engaging in parallel play. The pediatrician needs to determine the most appropriate next step in assessing the child's growth and development. Option A. Focus exclusively on objective measures of motor development during the physical examination, as this is the most easily quantifiable aspect of development. Option B. Immediately refer the child to a developmental pediatrician and a speech-language pathologist based solely on the caregiver's subjective report of unusual behaviors. Option C. Conduct a comprehensive developmental assessment including a detailed history, direct observation of the child's interactions and play, and administer age-appropriate standardized screening tools for language, social-emotional development, and motor skills. Option D. Reassure the caregivers that most children develop at their own pace, and schedule a routine well-child visit in 6 months to reevaluate the child's progress. The correct answer is C. Conduct a comprehensive developmental assessment including a detailed history, direct observation of the child's interactions and play, and administer age-appropriate standardized screening tools for language, social-emotional development, and motor skills. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric practice, discerning between normal developmental variations and potential red flags requiring further investigation. The professional challenge lies in balancing the need for timely intervention with the risk of over-medicalization or parental anxiety stemming from unnecessary referrals. Accurate assessment requires a nuanced understanding of developmental milestones, an awareness of cultural and environmental influences, and the ability to communicate effectively with caregivers. Correct approach analysis. The correct approach emphasizes a comprehensive, multifaceted evaluation that integrates objective data with subjective caregiver concerns. This aligns with best professional practice as outlined by the American Academy of Pediatrics (OP) guidelines for developmental surveillance and screening. It prioritizes a thorough history, direct observation of the child's behavior and interactions, and the use of standardized screening tools when indicated. This systematic approach ensures that potential developmental delays are identified early, allowing for appropriate referral and intervention, thereby maximizing the child's potential for positive outcomes. It also respects the caregiver's perspective as a crucial component of the child's health assessment. Incorrect approaches analysis. One incorrect approach focuses solely on objective measures, disregarding caregiver input. This fails to acknowledge the vital role of parental observation in identifying subtle changes or concerns that may not be apparent during a brief clinical encounter. Ethically, it can lead to a breakdown in the patient-provider relationship and potentially miss critical early signs. Another incorrect approach relies exclusively on caregiver reports without objective assessment or standardized screening. While caregiver concerns are important, they can be influenced by anxiety, misinformation, or cultural interpretations of development. Without objective validation, this approach risks either over-referral or under-identification of genuine issues. A third incorrect approach involves immediate referral based on a single, isolated observation without further investigation. This can lead to unnecessary specialist appointments, increased healthcare costs, and parental distress, while potentially overlooking transient developmental fluctuations that are common in early childhood. It bypasses the essential steps of thorough assessment and differential diagnosis. Professional reasoning. Professionals should approach developmental assessments with a framework that includes 1. Active listening and validation of caregiver concerns. 2. Systematic developmental surveillance through history-taking and observation. 3. Utilization of age-appropriate screening tools to identify potential areas of concern. 4. Consideration of environmental and cultural factors. 5. A clear plan for follow-up and referral based on a comprehensive assessment, not isolated findings. This iterative process ensures a balanced and evidence-based approach to pediatric development. Question 11. Compliance review shows that a pediatrician has diagnosed a 10-month-old infant with failure to thrive based on weight falling below the 3rd percentile. The pediatrician's initial plan involves ordering a battery of genetic tests and a comprehensive allergy panel without a detailed feeding history, a thorough physical examination beyond basic measurements, or an assessment of the home environment. What is the most appropriate next step in managing this infant's failure to thrive? Option A. Initiate aggressive nutritional supplementation with high-calorie formulas and monitor weight gain, deferring further diagnostic workup until the infant shows no improvement. Option B. Focus solely on ruling out rare genetic disorders, as these are often the primary drivers of failure to thrive in infants presenting with significant growth deficits. Option C. Immediately refer the infant to a pediatric subspecialist for further evaluation, assuming the primary care physician lacks the expertise to manage complex failure to thrive cases. Option D. Conduct a comprehensive history including detailed feeding patterns, elimination, developmental milestones, and a thorough assessment of the home environment and family dynamics, followed by a targeted physical examination and judicious use of diagnostic tests based on initial findings. Correct answer is D. Conduct a comprehensive history including detailed feeding patterns, elimination, developmental milestones, and a thorough assessment of the home environment and family dynamics, followed by a targeted physical examination and judicious use of diagnostic tests based on initial findings. Explanation. This scenario presents a professionally challenging situation because failure to thrive (FTT) in a pediatric patient is a complex multifactorial issue that requires a systematic and thorough diagnostic approach. The challenge lies in differentiating between organic causes, non-organic causes, environmental, psychosocial, and mixed etiologies, all while ensuring the child's immediate safety and nutritional well-being. The physician must navigate potential parental factors, resource limitations, and the urgency of the situation, demanding careful judgment and adherence to established clinical guidelines and ethical principles. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation. This involves a detailed history, physical examination, and appropriate investigations to identify underlying medical conditions. Crucially, it also includes a thorough assessment of the home environment and family dynamics, recognizing the significant impact of psychosocial factors on a child's growth. This holistic approach aligns with the American Board of Pediatrics' emphasis on patient-centered care and the recognition of social determinants of health. Adhering to established diagnostic pathways and consulting with specialists when indicated ensures that all potential causes are considered and addressed, leading to optimal outcomes for the child. This approach is ethically sound as it prioritizes the child's welfare and safety above all else. An incorrect approach that focuses solely on a single potential cause without a comprehensive workup is professionally unacceptable. For instance, attributing FTT solely to parental neglect without ruling out organic causes could lead to delayed diagnosis and treatment of a serious medical condition, violating the ethical duty to provide appropriate care. Conversely, ordering extensive, costly, and potentially invasive tests without a clear clinical indication based on initial assessment, or without considering the psychosocial context, represents inefficient and potentially harmful practice. This could lead to unnecessary patient distress, financial burden on the family, and diversion of resources from more critical needs. It fails to meet the standard of care expected by the American Board of Pediatrics, which emphasizes judicious use of diagnostic tools and a patient-centered approach. The professional decision-making process for similar situations should involve a structured approach. 1. Initial assessment, Gather a detailed history, feeding, elimination, developmental, family, social, and perform a thorough physical examination, including accurate growth parameter measurements. 2. Differential diagnosis. Formulate a broad differential diagnosis encompassing organic, non-organic, and mixed causes of FTT. 3. Diagnostic strategy. Develop a stepwise diagnostic plan, starting with the most likely and easily reversible causes, and progressing to more complex investigations as indicated by the initial findings. This should include a careful consideration of the home environment and family support systems. 4. Intervention and monitoring. Implement appropriate nutritional interventions and monitor the child's growth response closely. 5. Consultation and collaboration. Seek consultation from specialists, e.g., gastroenterology, endocrinology, developmental pediatrics, social work as needed. 6. Ethical considerations. Continuously assess for child safety and consider reporting to Child Protective Services if there is evidence of abuse or neglect, while maintaining a supportive relationship with the family. Question 12. Cost-benefit analysis shows that implementing a comprehensive, multidisciplinary care model for children with persistent asthma, including regular family education, home environmental assessments, and coordinated care with school nurses, leads to fewer emergency department visits and hospitalizations, thereby reducing overall healthcare expenditures. Considering the American Board of Pediatrics' emphasis on evidence-based and patient-centered care, which of the following approaches best aligns with these principles for managing pediatric asthma? Option A. Implement a proactive, multidisciplinary care plan that includes regular patient and family education on asthma triggers and medication adherence, environmental control strategies, and coordinated communication with school personnel. Option B. Delegate all asthma management to a single pulmonologist, limiting the involvement of primary care physicians and other allied health professionals to reduce perceived care fragmentation. Option C. Focus on minimizing healthcare costs by restricting access to inhaled corticosteroid therapies and encouraging families to rely on less expensive, but potentially less effective, alternative treatments. Option D. Prioritize reactive treatment of acute asthma exacerbations, focusing on bronchodilator use and short courses of oral corticosteroids as needed, with minimal emphasis on preventative strategies or family education. The correct answer is D. Prioritize reactive treatment of acute asthma exacerbations, focusing on bronchodilator use and short courses of oral corticosteroids as needed, with minimal emphasis on preventative strategies or family education. Explanation. This scenario presents a common challenge in pediatric chronic care management, balancing the immediate needs of a child with a chronic condition against the long-term sustainability of care delivery and resource allocation. The professional challenge lies in navigating the complexities of evidence-based practice, patient-centered care, and the practical realities of healthcare systems, all within the regulatory framework governing pediatric practice in the United States. The American Board of Pediatrics (AP) certification emphasizes a physician's ability to provide high-quality, ethical, and evidence-based care. Therefore, decisions must align with established guidelines and ethical principles that prioritize patient well-being while acknowledging system constraints. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary, and patient-centered strategy for managing a chronic condition like asthma. This aligns with ABP's emphasis on continuous quality improvement and evidence-based management. It acknowledges that effective chronic care requires more than just episodic medical intervention. It necessitates ongoing education, support, and coordination among various healthcare professionals and the family. This approach is ethically sound, as it promotes shared decision-making, empowers families, and aims to optimize the child's health outcomes and quality of life. From a regulatory perspective, adherence to established clinical practice guidelines for asthma management, which are often informed by organizations like the National Asthma Education and Prevention Program, NEP, is expected. An incorrect approach that focuses solely on reactive treatment of acute exacerbations fails to meet the ABP's expectations for comprehensive chronic disease management. Ethically, this approach neglects the proactive and preventative aspects of care, potentially leading to poorer long-term outcomes and increased healthcare utilization. It also fails to adequately support the family in managing the condition, which is a cornerstone of effective chronic care. Another incorrect approach that relies exclusively on a single specialist without involving a multidisciplinary team overlooks the complexity of chronic conditions. This can lead to fragmented care, missed opportunities for integrated management, and a lack of holistic support for the child and family. It may also be less cost-effective in the long run due to potential inefficiencies and unaddressed psychosocial factors. A third incorrect approach that prioritizes cost savings above all else, potentially by limiting access to necessary therapies or support services, is ethically problematic and may violate regulatory expectations for providing appropriate medical care. While cost-effectiveness is a consideration in healthcare, it should not compromise the quality of care or the well-being of the child. This approach could lead to adverse health outcomes, increased emergency room visits, and ultimately higher costs. The professional reasoning process for similar situations should involve a thorough assessment of the child's and family's needs, a review of current evidence-based guidelines for the specific chronic condition, and consideration of available resources. Engaging in shared decision-making with the family is crucial. Physicians should advocate for comprehensive care models that integrate medical management with education, psychosocial support, and coordination across different healthcare settings and providers. Continuous evaluation of treatment effectiveness and adaptation of the care plan based on the child's evolving needs and response are also essential components of high-quality pediatric chronic care. Question 13. Implementation of a diagnostic strategy for a suspected vitamin deficiency in a pediatric patient. What is the most appropriate initial step for a pediatrician? Option A. Conduct a thorough clinical assessment including history, physical examination, and targeted laboratory investigations. Option B. Advise the parents to adjust the child's diet based on general recommendations for healthy eating. Option C. Initiate empirical high-dose vitamin supplementation based on clinical suspicion alone. Option D. Order a broad-spectrum vitamin panel to screen for all possible deficiencies. The correct answer is D. Order a broad-spectrum vitamin panel to screen for all possible deficiencies. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric practice, identifying and managing vitamin deficiencies in a potentially vulnerable population. The professional challenge lies in accurately diagnosing the deficiency, understanding the underlying causes, and implementing an evidence-based treatment plan that aligns with current pediatric guidelines and regulatory standards for patient care. Misdiagnosis or inappropriate treatment can lead to significant long-term health consequences for the child, including developmental delays and irreversible physical impairments. Furthermore, ensuring appropriate parental education and follow-up is crucial for adherence and successful management. Correct approach analysis. The correct approach involves a comprehensive evaluation that includes a detailed history, physical examination, and targeted laboratory investigations to confirm the suspected vitamin deficiency. This aligns with the American Academy of Pediatrics, (OP), guidelines and general principles of evidence-based medicine, which emphasize a systematic diagnostic process. Prompt initiation of appropriate supplementation, tailored to the specific deficiency and the child's age and clinical status, is essential. Regular follow-up to monitor treatment efficacy and address any ongoing concerns is also a cornerstone of best practice, ensuring the child's well-being and preventing recurrence. This approach prioritizes patient safety and optimal health outcomes, adhering to the professional and ethical obligations of pediatric care. Incorrect approaches analysis. One incorrect approach would be to immediately initiate high-dose vitamin supplementation without a confirmed diagnosis. This bypasses the diagnostic process, potentially masking other underlying conditions, and could lead to vitamin toxicity, which carries its own set of risks. It fails to adhere to the principle of first, do no harm, and disregards the need for evidence-based diagnosis before intervention. Another incorrect approach would be to dismiss parental concerns about potential vitamin deficiency without a thorough evaluation. This demonstrates a lack of patient-centered care and could lead to a misdiagnosis, negatively impacting the child's health. It violates the ethical obligation to take parental concerns seriously and conduct appropriate clinical assessments. A third incorrect approach would be to rely solely on anecdotal evidence or non-validated diagnostic methods. This deviates from established medical practice and regulatory expectations for diagnostic accuracy and patient care. It risks misdiagnosis and inappropriate treatment, jeopardizing the child's health and undermining professional credibility. Professional reasoning. Professionals should approach suspected vitamin deficiencies by first gathering comprehensive clinical information. This includes a detailed dietary history, assessment of risk factors, e.g., prematurity, malabsorption syndromes, exclusive breastfeeding without supplementation, and a thorough physical examination. Based on this initial assessment, targeted laboratory tests should be ordered to confirm the specific deficiency. Once diagnosed, treatment should be initiated according to established guidelines, with careful consideration of dosage, route of administration, and duration. Ongoing monitoring and patient/family education are critical components of successful management. This systematic, evidence-based approach ensures accurate diagnosis, safe and effective treatment, and optimal patient outcomes, aligning with the professional standards and ethical responsibilities expected in pediatric practice. Question 14. Governance review demonstrates that a pediatric patient with multiple complex special dietary needs, including severe allergies and a diagnosed feeding disorder, has been receiving inconsistent nutritional support. The pediatrician is tasked with developing a revised, comprehensive dietary management plan. Which of the following approaches best aligns with current pediatric practice guidelines and ethical considerations for managing such a case? Option A. Develop an individualized, evidence-based dietary plan in collaboration with a registered dietitian specializing in pediatric nutrition and relevant subspecialists, ensuring parental input and ongoing monitoring. Option B. Implement a standardized dietary protocol that has proven effective for a majority of children with similar diagnoses, without extensive individual customization. Option C. Rely primarily on the pediatrician's extensive clinical experience to formulate a dietary regimen, assuming that common dietary recommendations for similar conditions will suffice. Option D. Delegate the primary responsibility for dietary planning to the parents, providing only general advice and trusting their judgment to manage the child's complex needs. The correct answer is A. Develop an individualized, evidence-based dietary plan in collaboration with a registered dietitian specializing in pediatric nutrition and relevant subspecialists, ensuring parental input and ongoing monitoring. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate nutritional needs of a child with complex special dietary requirements against the practical limitations and resource constraints of a healthcare setting. Pediatricians must navigate parental concerns, evidence-based guidelines, and the ethical imperative to provide appropriate care, all while ensuring patient safety and adherence to established protocols. The potential for adverse health outcomes due to inadequate or inappropriate dietary management underscores the need for meticulous decision-making. Correct approach analysis. The correct approach prioritizes a comprehensive, multidisciplinary assessment and individualized care plan. This aligns with best professional practice by ensuring that the child's unique needs are thoroughly understood and addressed by a team of experts. It reflects the American Academy of Pediatrics, OPL recommendations for managing children with special healthcare needs, emphasizing collaboration and evidence-based interventions. This approach is ethically sound as it upholds the principle of beneficence by actively seeking the best possible outcome for the child and respects parental autonomy by involving them in the decision-making process. Regulatory frameworks, such as those governing the provision of care for children with disabilities and chronic conditions, implicitly support such a comprehensive and coordinated approach. Incorrect approaches analysis. One incorrect approach involves solely relying on the pediatrician's personal experience without consulting specialists or involving a registered dietitian. This is a regulatory and ethical failure because it bypasses established best practices for managing complex pediatric nutrition, potentially leading to suboptimal or harmful dietary recommendations. It neglects the principle of non-maleficence by increasing the risk of adverse events due to incomplete knowledge or oversight. Another incorrect approach is to implement a standardized, one-size-fits-all dietary protocol for all children with similar diagnoses, disregarding the specific nuances of the individual child's condition, allergies, or family preferences. This is a failure to adhere to the ethical principle of justice, as it does not provide individualized care, and it contravenes the spirit of guidelines that advocate for personalized medicine. It also risks violating regulatory expectations for tailored care plans for children with special healthcare needs. A third incorrect approach is to defer all dietary decisions to the parents without providing adequate guidance or evidence-based recommendations, assuming parental expertise is sufficient. While parental involvement is crucial, the pediatrician retains ultimate responsibility for ensuring the child receives appropriate medical care, including nutritional management. This approach represents an abdication of professional responsibility and a potential ethical failure to provide necessary medical guidance, which could lead to detrimental health consequences for the child. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment of the child's medical history, current nutritional status, and specific dietary needs. This should be followed by consultation with relevant specialists, such as pediatric gastroenterologists, allergists, and registered dietitians specializing in pediatric nutrition. A collaborative care plan should then be developed in partnership with the parents, incorporating evidence-based recommendations and considering the family's capacity and preferences. Regular follow-up and monitoring are essential to adjust the plan as the child's needs evolve. This systematic, evidence-based, and collaborative approach ensures optimal care and minimizes risks. Question 15. Investigation of a 4-year-old child with a newly diagnosed life-threatening bacterial sepsis reveals that the parents, due to deeply held religious beliefs, are refusing the recommended intravenous antibiotic therapy, opting instead for prayer and spiritual healing. The child is deteriorating rapidly, and without prompt treatment, the prognosis is grave. Option A. Attempt to persuade the parents to accept the antibiotic therapy by explaining the severity of the illness and the potential for irreversible harm, while also exploring any potential compromises or alternative treatments that align with their beliefs, if medically feasible. Option B. Initiate intravenous antibiotic therapy immediately, seeking legal intervention if necessary to ensure the child's life-saving treatment. Option C. Respect the parents' wishes and continue to monitor the child's condition, providing only supportive care and spiritual comfort. Option D. Refer the child to another physician who may be more amenable to the parents' beliefs, thereby avoiding direct conflict. The correct answer is B. Initiate intravenous antibiotic therapy immediately, seeking legal intervention if necessary to ensure the child's life-saving treatment. Explanation. This scenario presents a professional challenge due to the inherent conflict between parental autonomy and the pediatrician's duty to protect the child's well-being, particularly when parental beliefs may lead to harm. The pediatrician must navigate this ethical tightrope, balancing respect for family values with the imperative to provide evidence-based medical care. The American Board of Pediatrics emphasizes a commitment to child advocacy and the application of sound medical judgment in all clinical situations. The correct approach represents best professional practice because it prioritizes the child's immediate health and safety while attempting to maintain a therapeutic relationship with the family. This involves seeking to understand the parents' concerns, providing clear and empathetic education about the medical necessity of the treatment, and exploring all avenues for achieving compliance, including involving hospital ethics committees or social work services if necessary. This aligns with the ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, as well as the professional responsibility to advocate for vulnerable patients. An incorrect approach that involves immediately overriding parental wishes without thorough discussion and exploration of alternatives would be professionally unacceptable. This could be seen as a failure to respect parental rights and could erode trust, potentially leading to further noncompliance or alienation of the family from the healthcare system. It might also be viewed as a premature escalation without exhausting less coercive measures, which is contrary to best practices in shared decision-making and patient-centered care. Another incorrect approach, such as abandoning the patient without ensuring continuity of care or appropriate referral, would be a significant ethical and professional failing, as it neglects the pediatrician's duty of care and the child's ongoing medical needs. Professionals should approach such situations by first engaging in open and empathetic communication with the parents, seeking to understand their rationale and addressing their specific concerns. This should be followed by a clear explanation of the medical condition, the proposed treatment, and the potential consequences of noncompliance, presented in an understandable manner. If consensus cannot be reached, Consulting with colleagues, ethics committees, or social services can provide valuable guidance and support in navigating complex ethical dilemmas and ensuring the child's best interests are met. Question 16. The performance metrics show a significant number of infants in your practice are being introduced to solid foods before 4 months of age, and a substantial portion of parents are delaying the introduction of common allergens like peanut and egg beyond 9 months. Which of the following strategies best aligns with current American Board of Pediatrics guidelines for the introduction of solid foods? Option A. Emphasize the exclusive use of iron-fortified infant formula or breast milk until the infant is 1 year old, with no introduction of other foods. Option B. Educate parents that solid foods can be introduced around 6 months of age, when the infant exhibits signs of readiness, and discuss the timely introduction of common allergens as part of this process. Option C. Recommend delaying the introduction of all solid foods until the infant is at least 7 months old to minimize the risk of digestive upset and allergies. Option D. Advise parents to begin pureed vegetables and fruits at exactly 4 months of age to ensure adequate nutrient intake and prevent future feeding issues. The correct answer is B. Educate parents that solid foods can be introduced around 6 months of age, when the infant exhibits signs of readiness, and discuss the timely introduction of common allergens as part of this process. Explanation. The performance metrics show a concerning trend in the timing and method of solid food introduction among infants in a particular pediatric practice. This scenario is professionally challenging because it requires balancing parental autonomy and preferences with evidence-based guidelines, and the pediatrician's responsibility to promote optimal infant health and development. Misinformation or adherence to outdated practices regarding solid food introduction can lead to nutritional deficiencies, allergies, or feeding difficulties. Careful judgment is required to provide accurate, individualized guidance that respects the family's cultural context and socioeconomic factors while prioritizing the infant's well-being. The correct approach represents best professional practice because it aligns with current American Academy of Pediatrics (OP) recommendations and established pediatric nutrition guidelines. These guidelines emphasize introducing a variety of nutrient-dense foods, including those with potential allergens, around 6 months of age, when the infant shows signs of readiness. This approach supports adequate iron intake, promotes the development of healthy eating habits, and can help prevent or mitigate food allergies. It involves a shared decision-making process with parents, providing them with clear, evidence-based information and addressing their concerns. An incorrect approach that relies solely on a fixed age, e.g., exactly 4 months for introducing solids, regardless of infant readiness cues, fails to adhere to current best practices. This can lead to infants consuming solids before their digestive systems are mature enough, potentially increasing the risk of gastrointestinal upset or aspiration. It also misses the opportunity to introduce a diverse range of foods, a critical developmental window. Another incorrect approach that delays the introduction of common allergens beyond 6 months, without a specific medical contraindication, is professionally unacceptable. Current AAP guidelines advocate for the timely introduction of allergens like peanut, egg, and dairy around 6 months to potentially reduce the risk of developing food allergies. Delaying this introduction without a valid reason contradicts this evidence-based strategy. A third incorrect approach that focuses exclusively on pureed foods and avoids textured or finger foods, even when the infant demonstrates readiness for them, limits the development of oral motor skills and can contribute to picky eating later in childhood. While purees are a starting point, a progressive introduction of textures is crucial for healthy development. The professional decision-making process for similar situations should involve a thorough assessment of the infant's developmental readiness, including head control, sitting ability, and interest in food. It requires open communication with parents to understand their concerns, beliefs, and cultural practices. The pediatrician must then provide clear, evidence-based guidance, referencing current AAP guidelines, and collaboratively develop a personalized plan for solid food introduction. This plan should be flexible and adaptable as the infant progresses, with ongoing monitoring and support. Question 17. Quality control measures reveal that a pediatrician has observed subtle but consistent deviations from age-appropriate developmental milestones in a 2-year-old child during routine well-child visits. The pediatrician suspects a potential early developmental delay, but has not yet discussed these specific observations with the child's parents. What is the most appropriate next step in the identification and management of this child's potential developmental delay, adhering to American Board of Pediatrics standards? Option A. Document the observations in the child's chart and wait for the parents to express concerns about their child's development before initiating any discussion or further action. Option B. Immediately refer the child to a developmental pediatric specialist for comprehensive evaluation without prior discussion with the parents to ensure prompt diagnosis. Option C. Schedule a follow-up appointment to discuss the specific observations with the parents, explain the rationale for concern, and collaboratively develop a plan for further assessment or intervention. Option D. Inform the parents that their child is likely experiencing a developmental delay and recommend a specific therapy program without conducting further formal assessment. The correct answer is C. Schedule a follow-up appointment to discuss the specific observations with the parents, explain the rationale for concern, and collaboratively develop a plan for further assessment or intervention. Explanation. This scenario presents a common challenge in pediatric practice, balancing the need for timely and accurate diagnosis with the ethical and legal obligations to protect patient privacy and obtain informed consent. The professional challenge lies in navigating the complexities of identifying a potential developmental delay in a young child, where subtle signs may be present, and determining the appropriate next steps in management without overstepping boundaries or causing undue alarm to the family. Careful judgment is required to ensure that interventions are evidence-based, family-centered, and aligned with established professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, collaborative, and family-driven process. It involves open communication with the parents, sharing observations in a non-judgmental manner, and empowering them to participate in decision-making regarding further evaluation. This aligns with the American Academy of Pediatrics (OP) guidelines on developmental surveillance and screening, which emphasize the importance of a partnership between the pediatrician and the family. It also respects the principle of informed consent, ensuring that parents understand the rationale for any proposed interventions and have the opportunity to ask questions and express concerns. This approach fosters trust and promotes adherence to recommended follow-up, ultimately benefiting the child's developmental trajectory. An incorrect approach that involves immediately referring the child for extensive, specialized testing without a thorough discussion with the parents is professionally unacceptable. This fails to uphold the ethical principle of beneficence by potentially causing unnecessary anxiety and financial burden to the family. It also disregards the importance of shared decision-making, which is a cornerstone of patient-centered care. Furthermore, it could be seen as a violation of the principle of non-maleficence if the testing is not clearly indicated or if it leads to overdiagnosis or unnecessary interventions. Another incorrect approach, such as delaying any discussion with the parents about the observed concerns, is also professionally unacceptable. This neglects the pediatrician's duty to identify potential issues early and to provide timely guidance. It could lead to a missed opportunity for early intervention, which is critical for optimizing developmental outcomes. This failure to act proactively could be considered a breach of professional responsibility and a deviation from best practices in pediatric care. The professional decision-making process for similar situations should involve a systematic approach. First, the pediatrician should meticulously document all observations and concerns, referencing developmental milestones and established screening tools. Second, they should prepare to communicate these observations to the parents in a clear, empathetic, and non-alarming manner, framing them as opportunities for proactive support. Third, they should actively listen to parental concerns and incorporate their insights into the plan. Fourth, they should collaboratively develop a plan that may include further observation, targeted screening, or referral for specialized evaluation, ensuring that the family understands the rationale and agrees with the proposed steps. Finally, ongoing communication and follow-up are essential to monitor progress and adjust the plan as needed. Question 18. The assessment process reveals a 15-year-old female presenting with a history of restrictive eating, excessive exercise, and significant weight loss over the past 6 months. She denies any concerns about her body weight or shape and expresses satisfaction with her current eating habits. Her physical examination shows bradycardia and mild hypotension. Which of the following approaches best aligns with the comprehensive management principles expected for pediatric patients with suspected eating disorders? Option A. Conduct a thorough medical evaluation to rule out other causes of weight loss. Engage a mental health professional specializing in eating disorders for psychological assessment, and involve a registered dietitian for nutritional evaluation and management. Option B. Refer the patient for outpatient nutritional counseling and schedule a follow-up appointment in 3 months to reassess weight. Option C. Initiate immediate inpatient psychiatric hospitalization for intensive nutritional rehabilitation and behavioral therapy. Option D. Advise the patient and her parents to focus on increasing caloric intake at home and monitor for any further weight loss without involving other specialists. The correct answer is C. Initiate immediate inpatient psychiatric hospitalization for intensive nutritional rehabilitation and behavioral therapy. Explanation. This scenario presents a common challenge in pediatric practice, identifying and managing eating disorders in adolescents, which requires a nuanced approach that balances diagnostic accuracy with patient well-being and adherence to professional guidelines. The professional challenge lies in the subtle presentation of eating disorders, the potential for denial or minimization by the patient and family, and the need to integrate medical, psychological, and nutritional assessments. Ensuring patient confidentiality while involving necessary support systems is also a critical ethical consideration. The correct approach represents best professional practice by prioritizing a comprehensive, multidisciplinary assessment. This aligns with the American Board of Pediatrics' emphasis on evidence-based care and holistic patient management. Specifically, it reflects the understanding that eating disorders are complex biopsychosocial conditions requiring input from various specialists. This approach ensures that all aspects of the patient's health are addressed, from physical complications to psychological distress and nutritional deficiencies, thereby promoting optimal recovery and preventing long-term sequelae. Adherence to established diagnostic criteria and treatment guidelines, as expected by the ABP, is paramount. An incorrect approach that focuses solely on weight restoration without addressing underlying psychological factors fails to recognize the multifaceted nature of eating disorders. This oversight can lead to relapse and does not meet the comprehensive care standards expected by the ABP, potentially violating ethical obligations to provide thorough treatment. Another incorrect approach that involves immediate hospitalization without a thorough outpatient assessment might be premature and could unnecessarily stigmatize the patient or disrupt their social and academic life, contradicting the principle of least restrictive intervention when clinically appropriate. Furthermore, failing to involve a mental health professional or a registered dietitian specialized in eating disorders represents a significant gap in care, as these professionals are crucial for effective management and violate the expectation of collaborative, evidence-based practice. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's physical status, psychological state, and nutritional intake. This includes utilizing validated screening tools, conducting thorough history-taking with both the patient and family, while respecting confidentiality, and consulting with or referring to specialists as indicated. The decision to escalate care, such as hospitalization, should be based on established medical and psychiatric criteria for severity and risk, rather than solely on weight. Maintaining open communication with the patient and family, while upholding ethical boundaries, is essential throughout the assessment and treatment planning process. Question 19. The analysis reveals a caregiver expressing significant concern regarding their 8-month-old infant's perceived inadequate intake of solid foods and slow weight gain, stating the infant barely eats anything and isn't growing like other babies. The caregiver is anxious and has researched various high-calorie formulas and supplements online. What is the most appropriate initial step in assessing this situation? Option A. Conduct a comprehensive dietary history, assess growth parameters using standardized charts, and perform a physical examination to identify any contributing factors to the infant's feeding and growth. Option B. Immediately recommend a high-calorie infant formula supplement to address the caregiver's concerns about weight gain and perceived inadequate intake. Option C. Advise the caregiver that infant feeding patterns can be highly variable and suggest they simply increase the frequency of offering solids without further assessment. Option D. Focus solely on the quantity of solid food the infant consumes during observed feeding sessions to quantify the perceived inadequate intake. Correct answer is A. Conduct a comprehensive dietary history, assess growth parameters using standardized charts, and perform a physical examination to identify any contributing factors to the infant's feeding and growth. Explanation. The analysis reveals a common yet complex scenario in pediatric nutrition, where a caregiver expresses concern about a child's growth and feeding habits, prompting a need for a comprehensive risk assessment. The professional challenge lies in distinguishing between normal variations in infant feeding and potential underlying issues that could impact long-term health and development, all while respecting the caregiver's concerns and ensuring adherence to established pediatric guidelines. A thorough risk assessment is paramount to avoid unnecessary interventions or, conversely, to identify and address critical nutritional deficiencies or feeding disorders early. The correct approach involves a systematic, multifaceted risk assessment that prioritizes gathering comprehensive information. This includes detailed dietary history, assessment of the infant's growth trajectory against standardized growth charts, e.g., WHO or CDC growth charts, as per U.S. guidelines, observation of feeding dynamics, and a thorough physical examination to rule out any organic causes for poor feeding or growth. This approach aligns with the American Academy of Pediatrics OP guidelines on pediatric nutrition and feeding, which emphasize a holistic evaluation. Ethically, this represents best professional practice by ensuring that interventions are evidence-based, individualized, and directly address identified risks, thereby promoting the child's well-being and development. An incorrect approach would be to immediately recommend a specific dietary supplement or to dismiss the caregiver's concerns without a thorough evaluation. Recommending a supplement without a clear indication of deficiency or need, as determined by a risk assessment, could lead to unnecessary costs for the family and potentially mask underlying issues. Dismissing concerns without adequate investigation fails to uphold the professional responsibility to address caregiver-reported issues, potentially eroding trust and delaying necessary care. Another incorrect approach would be to focus solely on the quantity of food consumed without considering the quality, nutrient density, or the infant's overall developmental stage and feeding skills, which are crucial components of a comprehensive nutritional risk assessment. Professionals should employ a decision-making framework that begins with active listening to the caregiver's concerns, followed by a structured data-gathering process. This includes obtaining a detailed history, performing a physical examination, and utilizing appropriate assessment tools like growth charts. Based on this comprehensive data, the professional can then identify specific risk factors, determine the need for further investigations, and formulate an individualized management plan. This systematic approach ensures that decisions are data-driven, ethically sound, and aligned with best practices in pediatric care. Question 20. System analysis indicates a newborn infant presents with severe anemia and is rapidly deteriorating. The attending pediatrician has determined that an immediate blood transfusion is medically necessary to prevent death. The infant's parents, who are devout members of a religious group that strictly prohibits blood transfusions, refuse consent for the procedure, citing their religious beliefs. Pediatrician believes that withholding the transfusion will almost certainly result in the infant's death within hours. What is the most appropriate course of action for the pediatrician in this ethically and legally complex situation, adhering strictly to U.S. pediatric medical ethics and legal frameworks? Option A. Immediately petition a court for an emergency order authorizing the life-saving blood transfusion, while continuing to provide supportive care. Option B. Respect the parent's religious objections and withhold the blood transfusion, allowing the natural course of events to unfold. Option C. Attempt to engage in extensive, prolonged discussions with the parents to persuade them to change their religious beliefs regarding transfusions. Option D. Administer the blood transfusion without parental consent or legal authorization to save the infant's life. Correct answer is A. Immediately petition a court for an emergency order authorizing the life-saving blood transfusion, while continuing to provide supportive care. Explanation. Scenario analysis. This scenario presents a significant ethical dilemma for a pediatrician. The challenge lies in balancing the parent's deeply held religious beliefs, which prohibit blood transfusions, with the pediatrician's ethical and legal obligation to act in the best interest of the child, especially when a life-saving intervention is available. the pediatrician must navigate potential conflicts between parental autonomy and the child's right to life and health, all within the framework of U.S. pediatric medical ethics and relevant state laws. The urgency of the situation, with the infant's condition deteriorating, adds immense pressure to the decision-making process. Correct approach analysis. The correct approach involves seeking immediate legal intervention to obtain a court order authorizing the necessary blood transfusion. This aligns with established pediatric medical ethics and U.S. law, which generally prioritize the well-being of a minor child when parental decisions pose a substantial risk of death or severe harm. The American Academy of Pediatrics, OP, and other professional bodies advocate for such interventions in life-threatening situations where parental religious objections conflict with essential medical care. This approach respects the child's right to life and health while acknowledging the legal framework that allows for overriding parental objections in extreme circumstances. It is a necessary step to ensure the infant receives life-saving treatment. Incorrect approach is analysis. One incorrect approach is to respect the parent's wishes and withhold the transfusion, despite the high likelihood of the infant's death. This fails to uphold the pediatrician's primary ethical duty to the child and violates the principle of beneficence. It also potentially exposes the pediatrician to legal liability for medical neglect. Furthermore, it disregards the legal precedent in many U.S. jurisdictions that allows for court intervention to protect a child's life from parental religious objections. Another incorrect approach is to attempt to persuade the parents through prolonged debate or coercion, without involving legal counsel or the hospital ethics committee. Communication is crucial in a life-threatening emergency. Delaying the necessary medical intervention while engaging in extended persuasion can be detrimental to the infant. This approach fails to recognize the urgency and the potential need for external legal authority to facilitate life-saving care when parental consent is withheld on religious grounds. A third incorrect approach is to unilaterally administer the transfusion without attempting to secure parental consent or legal authorization. While the intent might be to save the child's life, this action could be considered a violation of parental rights and could lead to legal repercussions for the medical team and the hospital, even if the outcome is positive. It bypasses the established legal and ethical processes for overriding parental objections, which typically involve judicial review. Professional reasoning. In such a critical situation, the pediatrician should immediately consult with the hospital's legal counsel and ethics committee. This multidisciplinary approach ensures that all ethical and legal considerations are thoroughly reviewed. The primary goal is to obtain a court order authorizing the transfusion, thereby protecting both the infant and the medical team. This process involves presenting the medical necessity of the transfusion and the risk of death to the court, allowing a judge to make a decision based on the child's best interests. This framework prioritizes the child's life while adhering to legal and ethical protocols for overriding parental objections in extreme circumstances.